Hello, everybody, and we're back with part two. This time, we want to take a look at burn classifications. Again, we want to get you ready for those exams, not just in class, but in NCLEX as well. So, nursing burn concepts, burn classifications, here we go. I'm RN Cliff Notes. I've been an advanced medical surgical professor for quite a long time, RN and LPN. And of course, we're here to help you see through the larger concepts, make things easier for you. All right? There's no sense in making this stuff tough. I tell you what, man, I had to struggle so bad in school. It's like, come on, somebody can break this down. You don't have to read every word off of the page and then try to make it make sense. All right? It helps to have a little bit of a guide. Read your book too, but it helps to have a little bit of a guide. Because we want you to be as thorough as you can be as a nurse. And that comes from having full understanding. You know, not being foggy about these concepts at all. We want you clear. All right, you know how we like to do. We like to get our engine primed up when we're doing these videos and hit you with a question. Here we go. Which thickness of burn would be considered second degree? Now, we changed these terms around over time. So we've gone from the degrees, and more so you're seeing these kind of thickness responses on your exams. However, you will come across degree from time to time. So let's get these connected properly. Which thickness of burn would be considered second degree? So we've got A, superficial partial thickness, B, full thickness, C, deep partial thickness. What do you think? And you said, because you're so smart, boom, that's right. Deep partial thickness is the same thing as second degree. Good job. All right, moving on. So, burn classifications, there they are. So, first degree, we want to refer to that as superficial partial thickness these days. Second degree, we want to refer to that as deep partial thickness. And third degree, full thickness. Now, if your head is swooning from all of this mention of thickness, right? It can get a little foggy there. Like, what the crap? Why can't they just leave it? All right, here's the easy. Here's the easy breezy lemon squeezy. So, right? Superficial, we know that's right to the top. And deep, but check out what that second word. What? Partial on both of those, right? Partial, not full. So we've got superficial, partial. That's the first degree. Deeper in, but still partial. Second degree. Then full thickness. No partial. It's the full thickness of it. That's the third degree. There you go. Right? Easy, easy. Okay. Burn classifications. Moving on. All right. So let me read some of this to you. So we've got first degree. Tissue damage is confined to the epidermis. That is important. We're going to look at some pictures. Epidermis, okay, the very top layer of your skin, and possibly a portion of the dermis, but don't let that throw you. Focus is on epidermis here. This is a type of injury produced by sunburn, okay, so that redness, all right, or low intensity flash. The skin appears red, but blanches with pressure. Don't be thrown off by that blanche word. Blanche is where that comes from, French. Blanche is the French way of saying white, okay? So it turns white when you press into it with your fingertip or your thumb. All right, that's important. If it doesn't turn white, you're not dealing with the, you've got some serious, you've got some skin breakdown happening there. That's no longer just a little bit of redness there. Okay, all right. So next, we want to talk about blisters. May or may not be present. That you can find in some descriptions on some exams, right? The client complains of tingling, increased skin sensitivity, and pain that is relieved with the application of cool water or lotions containing aloe. Injury heals within a week. All right? So very, very superficial sun type of burn. All right. Now, here's where we want to really focus in on. I want you to pay real close attention to this. Epidermis, right? Followed by the dermis, then the subcutaneous tissue and the muscle. And in this instance, this is very similar to when we talk about skin breakdown, or the old school way of saying it, the decubiti, right? The decubitus, ulceration of the skin, where a person's, unfortunately, hadn't been moved around enough, or exercise and range of motion kind of stuff. All right, so I want you to pay attention to that. It says epidermis, that's level 1. Okay, dermis is 2, subcutaneous 3, and then muscle 4. So breakdown is this. First degree, compromise what? The epidermis, the very first level. Second degree, compromise down to the dermis. This is where, all right, second degree, the epidermis is gone and you can see clear into the person's dermis. That would be second degree. Get it? So epidermis damage, what? First degree. Down to the dermis is damage, second degree, because it's the second layer. Okay? And if the epidermis and dermis are burned away and you can see down to the subcutaneous tissue, that would be what? Third degree. Absolutely. Right? So there you are. First, second, and third degree, depending on what layer of damage, how deep did it go? Okay. You get the idea. Okie dokie. So, next. All right. So, that second degree, or deep partial thickness, as we learned. Tissue damage involves the epidermis, upper dermis, right? So it's really important. They went to the second level. It passed the epidermis and went down to the dermis, all right? And portions of the deeper dermis. So deep partial thickness injury is common in scalds and flash flames. The area involved appears blistered with weeping and edema. All right, and especially in the case of blisters, they readily evolve down to the dermis, readily, when you've got a blister in the situation. And a very important factoid when you're taking a test, talking about burns, we never want to burst blisters, right, or pop a blister. You had sterile fluid under that thing until you stuck a needle in it or compromised it and then allowed it to get infected, okay? So that's typically not a therapeutic approach. We want to leave blisters intact when we're talking about burns, right? Your skin's your first line of defense. Don't damage it anymore, all right? The client experiences pain, increased skin sensitivity, which increases with exposure to air, and morphine or other opiate analgesics are given IV to control the pain. Great, and there's our mention of morphine or possibly other opiate-based analgesics. And be sure to check out my video about opiate analgesics so you have some fuller understanding about those as well. All right, but let's look at our levels. Here we go. So this partial thickness, but it's a second degree, right? So look at that. All right, and you can see where the wavy pink top area, that epidermis has been completely burned through, and it's down to the dermis. Great. So that's our second degree. Went past the epidermis and went down and damaged the dermis. Second degree, because it went to the second layer of skin. All right. All right, and lastly, we've got the third degree. Third degree, which we recognize as a full thickness burn. Tissue damage involves the epidermis and entire dermis, as we understand, right? So we're expecting it to go where? To the subcutaneous tissue, to the third layer, all right? So the damage usually extends into the subcutaneous tissue, including connective tissue, muscle, and bone. Destruction of nerve endings leaves the affected areas relatively pain-free. Now that is a little bit counterintuitive to some folks. When they come across that on an exam, how's a person going to be burned and be pain-free. But when you're talking about full thickness burns, why are they pain-free, right? There's the destruction of nerve endings. Yeah, so just kind of let that marinate some. All right, complicating the care of the client with full thickness injury is the development of hypovolemic burn shock. Here we go, right? What did we talk about earlier? Hyperkalemia, right? Hyperkalemia, what? Too high a level of potassium. And anemia, absolutely. Boy, do we need to chop that up. You know, I'll be definitely doing a video on that so we can get some fuller understanding. All right, and this is the picture of that full thickness burn. Full thickness, why? I went through all the layers there. So epidermis, went through the dermis, right? Down to the subcutaneous tissue and muscle. So down to that third layer and potentially the fourth layer. All right. And there you have your degrees of burn. Thank you for liking and subscribing. All right, everybody. See you in the next video.